Yate, Chairman Simpson, Ranking Member Pengree, and the committee as well, and your staff. My name is Dr. Buu Nygren, Navajo Nation President. Thank you for the opportunity to testify again before this honorable committee on behalf of the Navajo Nation's fiscal year 27 federal budget priorities and priorities in general in Indian country. Many of the items I will testify are rooted in our Treaty of 1868, and it is in that spirit of treaty and our government-to-government relationship that we continue to support the Navajo Nation's support for advance appropriations for IHS. Advance appropriations provide stability and continuity for essential health services that we've been enjoying the past couple of years, which allows us to better plan and efficiently utilize our funding. So we continue to urge Congress not only to continue these advance appropriations beyond fiscal year 27, but also to expand them to key programs within the BIA and the BIE to move toward mandatory funding for these core responsibilities. We urge support for advance appropriations to these agencies. Also, despite federal trust obligations, the federal investment remains far below of what is needed. Federal spending on the IHS is around $4,000 per person annually, which is less than half of what the federal government spends for other major federal health programs like the prison system and the military. The closing this gap is essential for improving the health and lowering overall costs created by preventable health issues. We remain frustrated by the funds. Also, we remain frustrated for the funds that were taken from the Gallup Indian Medical Center late last year. The GMIC is the oldest and the largest IHS facility in the country and is in dire need of a rebuild. While I appreciate the Honorable Secretary Kennedy's attention to this issue, including HHS's visit last week on Friday, we still need to find a way to get the $60 million that was transferred from this rebuild so we can continue to stay on track to get this project back on track. Education funding also must be strengthened. The BIE faces a $1 billion deferred maintenance backlog, an estimated $6 billion shortfall in all Indian country school replacements and construction needs, and severe staffing shortages for the 180-plus schools. We continue to urge Congress to increase funding for the Indian School Equalization Program by at least $400 million and fully fund school safety initiatives, including for school resource officers. Additionally, Congress must ensure that the BIE has additional funds to accommodate its assumption of the Department of Education's tribal programs. Funding delays or losses are unacceptable. Moving on to our public safety, our police department operates with roughly one officer for every 1,000 residents, or about 1/4 of what is recommended. Our officers respond to more than 200,000 calls for services each year across various distances ranging from 1 hour to 3 hours. 2 of our major public safety facilities were condemned in 2019 and have yet to be replaced, forcing officers and courts to operate out of temporary spaces. The BIA estimates that public safety needs in Indian country total $3.1 billion annually, yet current funding levels are less than $450 million. There is a substantial probate backlog in Indian country as well, and I also applaud Secretary Burgum, the Honorable Burgum, for making it a priority to resolve it. The BIE needs more assistance in its digitization probate efforts to help reduce this backlog. It is essential that on the Navajo Nation alone, there are tens of millions of dollars in assets in the probate backlog. Those assets should be with our people, and we request that Congress work with the BIA to identify what the full scope of needs, including providing more funding for our 638 contracts for vital records. We also urge Congress to strengthen funding for programs that protect Native children and families. The ICWA program is severely underfunded, leaving the Navajo Nation with $6 million in shortfalls in our ICWA program. We support full funding of $46 million for ICWA nationwide. We also request $60 million for programs under the Indian Child Protection and Family Violence Prevention Act to help address child abuse, neglect, and family violence in tribal communities across the country. The Navajo Nation's emergency medical services system, which responds to nearly 22,000 calls last year, continues to face severe funding shortages. Dedicated federal funding for tribal EMS is direly needed. Lastly, the Office of the Navajo and Hopi Indian Relocation Window. Relocation is winding down its operations, even though, by our estimates, at least 40 families have yet to still receive homes, and other federal promises have not been kept. Well, ONER was notoriously mismanaged. The BIA, which has taken ONER's functions, which has been active and communicative partner, I urge you to maintain sufficient funding for ONER's obligations so that this closeout process is not rushed and can be properly and humanely carried out. Thank you again for this opportunity and for honoring the treaties between our nations, and I look forward to the discussions that we're going to have here today. So,